Good morning, morning, good morning, morning.
I always say, what you eat again? Hey, hey, things will get better. Wouldn't last forever. No, things will get better. Hitting go last, hitting go last, hitting go last. But in the meantime, now better days are coming, change your ways. Don't let this moment pass you by and remain the same. Better days are coming, change your ways. Patrice and don't let this moment pass you by and remain the same. I want you doing with your time. I hope you're not wasting time. Oh, what you doing with your time? I'm not taking time right now, but better days are coming, change your ways. Don't let this moment pass you by and remain the same. Better days are coming, change your ways. Don't let this moment pass you by and remain the same.
Welcome back to the morning show here on Tobago Updates Television, and thank you so much for staying with us. We begin conversations this morning in studio by speaking with Secretary Natisha Charles-Pantin. She's the Secretary of Food Security, Natural Resources, the Environment and Sustainable Development. And this morning we begin our conversations about the Community Care Program. Good morning and welcome.
Good morning everyone. Good morning Tobago, Bagatelle, Bacalet. Howdy to everybody.
All right, so we have this initiative and we know that your division is a very large division, and you know there's so much going on. You have so many subsidiaries, so many companies, so many things happening within your division, and every time you spin around you hear something, whether it's reforestation, something is always happening. And so now we have this community care program that we are going to be learning about this morning. So let's get into the conversation in terms of the initiative, where it came from and the intention of it.
So the initiative stemmed from way back in terms of what we used to do with the food box initiative. And because we didn't have a packing house ready, and a packing house is basically where you would bring your fresh produce and, you know, for packaging and handling and all of that. So finally we got the packing house refurbished, and now farmers can come to the packing house and deliver their fresh produce, and that will filter into the community care program. And the community care program is an extension of the food box initiative, and it's really to take food security one step further. So the idea is to ensure that not only persons in Tobago have access to fresh produce, but also to ensure that you take care of your health. Yeah? So it's really in partnership with the Division of Health, Wellness and Social Protection. And let us look at the linkage. Recently, you would have heard the Good Secretary and the Deputy Chief Secretary state that the hospital is in full capacity. Yeah? Why is that? And, you know, when you think about it, how do we eat? What do we eat? Do we know where our food is coming from? And I don't want people to see it as just another way to give out things, you know. But actually what we're doing is monitoring your health with this supplement to your diet, right? Teaching you how to eat, exercise, and so we're taking care of that wellness aspect. So it's an effort to help the Division of Health, yeah? Because what we have in Tobago is a situation where a lot of people are suffering from non-communicable diseases, hypertension, diabetes. You're just hearing people falling down. So that is what it is about, caring for the community. Yeah. So it is, you know, you're marrying the support with you're supporting the farmers as well as you're supporting the community in terms of their health and wellness.
You know, initiatives like this, as you mentioned, you don't want it to be just a handout.
Correct.
The education part of it is very important. And I feel as if there's supposed to be like a change or a shift in culture in the way we do things. Just last week we were talking on the program, and we brought up the same conversation in terms of what the Deputy Chief Secretary said, the Secretary of Health, when she spoke about people are getting sicker. And we are not professionals, but our assessment is, what are we eating?
Correct.
What are we eating? So is there going to be an intense public education drive. Listen, this is not just a handout. We're going to hold your hand step by step to ensure you understand the importance, because sometimes when people get a freebie, they just run in the line. The first 10 people in the line, they get the best box and they go home and that's it. How do you intend to ensure that people remain conscious of the fact that this is not just for you to carry home today and next week you go back into your bad habits?
Okay. Now, when a person, when you and I eat, it is a matter of choice. Forcing people to eat right is a very difficult thing. I know a lot of us would have looked at that program, The Biggest Loser, and other programs in the US. And you would see, even though you're trying to control people's diets, they would always find a way to sneak in food. So changing people's choice is a very difficult thing. Sometimes it's based on your palate, your cravings. And let's be real, some of the foods that we eat, you don't know what sort of flavor enhancers in the food. So sometimes you're thinking, oh gosh, I feel for this type of food. But there's a flavor enhancer that is kind of causing you to have that craving. There is a challenge, of course, influencing people's choices. Even I had personal experiences trying to, I mean, you have close friends that might have suffered from a heart attack or a stroke. And even in during the recovery period, they'll still tell you, okay, you know, buy a slice of pizza for me, I'm feeling for pizza, even though they know they're not supposed to eat it. So the best way we could do that is to sort of hold their hands. And this is why the community care program asked persons, if you know you're suffering from a particular disease, you want to disclose that, we want to sign you up for the project, you know, so it is a matter of choice, really. We would have had people come into the project and really finding it tough to stay on course, but we continue to monitor, you know, and then in partnering with health would have submitted names of persons who, you know, they would have that in their records, as well as persons in the community that the different assemblymen or councillors might have identified that would need the support. Right? So it's a matter of you realizing that you need to control what you eat and, you know, volunteering your effort. But I'll tell you something though, which I found was successful, an indicator of success. So I don't know if you would have heard some employees from Tech might have experienced aneurysms, you know, they come in on the job, falling down. So Tech recently partnered, them and the union, they partnered with the division, and we are going to roll out an aspect of the community care program for their employees, training them on how to eat and see how we could influence them there in order, you know, so we're looking at it as a cohort. And once we show them how to eat, monitor their figures and numbers, then we're hoping that we have less deaths at Tech. Yeah. So we are not only focusing on, you know, poverty, but also in terms of controlling the number of deaths that you have as a result of poor eating habits. Yeah.
So, Secretary, as you mentioned, working with the cohort and so forth, I want to know the project. Is it a limited time only, or is it a year-long project? What is the division's vision in terms of the execution of the project?
Now, it's a pilot, and why it's a pilot? Because this is something new. If you notice that we didn't roll it out for elections because we didn't want it to seem as if it was part of elections. We genuinely want to change the diet and habits of persons, all of us in Tobago. Yeah. So we're going to look at this program, look at the success of it, and take out or add, because as we started out just supplementing people's diets, now we're going to go into a different aspect where poverty is no longer considered as the primary, one of the primary reasons why we're going to intervene, but also where persons on a whole, right? Tech as an example. money is not an issue for them, but it's to train them on how to eat, training them on what is gut health and different aspects of healthcare. So food security in itself is not just about holding farmers' hands, but also the population, the wider population, knowing what you eat, how to eat. Yeah, so I think all of us need to understand that if we're going to think about the future, right, we can't only think about, well, you have children, you want to be able to see your children graduate. Yeah, you want your children to eat healthy as well. So that is what we are embarking on, taking food security one step further.
And in terms of the Division of Health partnering, an important thing also is for people to know their numbers.
Yes.
I don't know if you have that information, but do you see the average Tobago person coming forward and ensuring they know their numbers, they know their statistics, where do they stand? Do they see the importance and the relevance of knowing this, or is it easier to just join the line in KFC and just buy a 2-piece and fries? How do you see that happening?
The access part is important, right? We don't want people to say we didn't have access to fresh food, fresh produce, and that is what we are trying to ensure. And I think that would take care of you saying you have to stand in a KFC line, because you have a choice. Would you want the squash or the pineapples, or as opposed to eating KFC? Yeah, but the access is important. A lot of low income people, they would say it's cheaper to eat that type of food, right? And some people, I'll be honest with you, you'll give hampers, bring relief to people. Some people prefer the hamper over fresh produce. They'll prefer the rice, the flour, and the sugar, right? So it is to try to change that type of culture where we think that food is only what we have processed and packaged and labeled, and we don't know exactly what is in there for you. So I'm not saying that you shouldn't eat rice, flour, and sugar, but I think everything in proportion is is appropriate. But you should have access to fresh produce.
Secretary, I know that you mentioned that it was a pilot project.
Yes.
Does this mean that you are accessing the participants through, like you said, the various assemblymen, or is it open to the public? Can the public sign up for now?
Oh, definitely. It is open to the public. We have publicized the number that you can contact. An evaluation will be done. But of course, the Division of Health is the first line where people would get, you'll know people who would want the assistance directly from health, right? But of course, you can directly come to the division and inquire about the community care program, and they will refer you to the Tobago Agritech company, right? For now, they are stationed at the division, but they are supposed to move by the end of the month into the new facility at Boku, right? Yes.
And what has been the buy-in like from farmers concerning this community care project?
Now, the buy-in is good. What we want to do for some of the farmers who were unable to access the program because of maybe excessive use of probably pesticides or fertilizers. So we're using our demonstration stations to equip them with the knowledge that they need to use environmentally friendly pesticides, fertilizers, in some cases where you don't even need to use those things, right? So it's really to train those that were not able to qualify. But of course, we are embracing everyone else. That you can also visit the division and register to be part of the community care program.
And when is the program rolling out?
The program is already,
okay.
Yeah, it's already, we have done 2 distributions so far, maybe 2 or 3, right? We want to move, at the end of August, we want to extend the program into the Tobago wholesale farmers market. I'm not sure if you're familiar with a wholesale market, but you can't just walk into a wholesale market and say, I need 2 pounds of cucumbers.
Right.
So it's really for retailers. It would be at the Shore Park Food Hub, right? So you would be able to come and buy in bulk and, distribute retail, right? So that is also another, and you could also be part of the community care program. I am hoping that for World Food Day, that this program and the wholesale market doesn't take away from there, because let's be truthful. We don't have all the produce that we would want in Tobago, and that is why we're looking at different ways to ensure that we beef up production, the production side, right, so that we can facilitate all these different initiatives.
All right. Of course, we do hope that, as Akinlabi asked, in terms of the buy-in from the farmers, but also the buy-in from the general Tobago public, it is open to all of you. I remember there's an assessment that will take place to ensure that you are in line for what is going to be distributed rather. And we also want you to focus on your general health. Even if you are not in line to collect from this particular initiative, you also have a responsibility for your own health and care and wellness, yours and that of your family. Check your numbers. The health centers are open. You can go. It's free to go and get your numbers checked, so you know where you stand, know your statistics, know what you need to do, know what you need to eat less of and more of. Green leafy vegetables. I'll never forget that from primary school. I remember them telling us to eat green leafy vegetables. So get to know your numbers, get to be in the know, and find out more about this community care program, so you can be a part of it. Tell somebody who might not know, who you think might need to be a part of it, so let them get registered, get assessed, and participate in what is happening here on the island of Tobago. In closing, is there anything else you'd like to share with our viewers?
Well, we didn't discuss the community project, right? I hope we have time. Yes, I hope we have some time.
Yeah, we can.
Right. But I want to say that we have a lot of initiatives around Tobago, like 5K runs, and I usually people will see me part of some of the aerobics and all of that. And we all have to be mindful that sometimes we don't know what's wrong with us. You might be walking somewhere and then you just drop down. That would have happened to me once. Yeah, I just fell down, and then I found out my blood count was 4.5. That's extremely low. So sometimes it happens to you randomly, and this is why, and it's good to have those experiences as a policy maker, because you have that closeness in terms of understanding what people go through and what is needed in the space, so that we contribute in a meaningful way at a policy level, so that it trickles down to everybody in terms of managing people's health and their wellness, and of course achieving our food security goals.
All right. So I'm not sure if that was part of your district Goodwill project that you were speaking about.
It should be a Goodwill, yeah, because that is extreme Goodwill. But when I first got into office that first year, we found a household, a lady that wasn't unable to qualify quickly for support to, get a home of her own. And she couldn't afford to pay rent. She had cancer in her eyes. She had a lot of things happening to her at the time. And we saw it fit to intervene, to give her, to let her know that we are out here for her. And that is when I stopped wearing all these straight hair and I started twisting my natural hair to save some money, to put towards that. And she's living in her home now. And, every time I go there, she would say very nice things, like she was praying or, so I actually felt the last time when I visited her, she said, I was just praying and then you appeared. And that was really, touching for me. And, so that is what the Goodwill project is about. Project Build 1, Project Build 2. It is a program where we intervene in cases where we do an assessment and we feel that people need urgent assistance. So we're on to Project Build 2. This person is from Mason Hall. This family, a family of four little beautiful girls, right? An elderly man and his wife. And we are... we started to get some materials from persons. People started to contribute towards it. I myself, my staff, all of us, we are getting together to help put that family in a place where we think is up to standard for the children especially. Yeah, so that is what the community goodwill project is about. Trying to ensure that we touch each household in the best way possible, as fast as possible, right? Given the resources that we have, it isn't government resources, it's it's a community thing, right? So that is what the project is about.
So is it a community by community based project? How do you go through each community, or how is it set up in terms of identifying that there's a person in this community who needs assistance?
So we, as a representative, as you walk through each community, because Mason Hall is part of Bagatelle Bacalet, right? You'll walk through each community and then you'll sort of rate persons based on what their needs are. Right? So you'd have to really be on the ground and understand each and every household, because you don't have, unlimited resources. It comes from our pockets, it comes from people who are volunteering. So we want to ensure that we make good use of what people contribute and also what we contribute, yeah? So that is what it's all about, ensuring that you're on the ground, understanding your constituents, and then you're putting them, you're rating who is in need of urgent, assistance.
So you go through a needs test with a needs assessment
That's
with
right.
persons.
That's right. Yeah.
Okay.
And you mentioned that it's not government funds. So it comes from your pockets, it comes from, in terms of persons contributing, willing rather to contribute, yes. What is the feedback like? What is the buy-in like in terms of, you come to me today and you say, Adanna, listen, I need $1,000 to buy a couple sheet of ply for this person. And then we move to another community and we see somebody else, they need probably their bathroom needs to be fixed urgently. Come on, you just help me to get some time. What is it like in terms of people saying, okay, cool, no problem, I'll get on board? Or do you have sponsors? How does that work? Because resources are not unlimited, so how does that work for you?
It actually works well, having that constituency or that electoral district, you'd have people within the district that know the people. So it isn't a scam or anything, right? People, they know that, okay, this person lives here. What Ms. Pantin is saying is accurate. So it's all about providing the assistance to people who, within the community, that people know that you really need the assistance. So they aren't strangers. We aren't strangers to each other, right? So that's basically it. Once it's within the community, people tend to know the people. So and they reach out accordingly. So people would say, okay, what do they need? You think they need groceries at this time? I have household items. You think this person will need? So they usually reach out to give what they can. Right? It's no pressure, it's what you can give, right? And I like to encourage persons not to give money. You can purchase a voucher, for example. You could visit Armando's or anyone of the hardware, and you purchase a voucher, and then we will say, okay, the house might need galvanized at this time, so we'll just go and purchase it with the voucher. So it's not necessarily a money thing, right? It's actually given access to what we can at the point in time. Yeah, so we're encouraging persons to do that, go through that channel.
And what about networking with businesses in the constituency, as well as skilled tradesmen and that kind of thing to help execute those projects?
So we are networking with businesses actually contribute in different ways. So they may say, okay, you can get material, but we wouldn't pay any VAT on it, or pay for delivery, right? You get that type of assistance. Sometimes they will give you material up to a certain amount. That happens as well, right? And of course, you have other persons. Mr. Joe Field came. He's also going to help with the construction, right, of the buildings, giving his service, people within the community as well. So we have people who are genuinely coming forward. They know of the circumstances, so it is not any sort of strange thing. And of course, if you have a contribution, it doesn't have to be money at all, right? Feel free to purchase a voucher anywhere, and we will use that. Yes.
All right, ladies and gentlemen, we have been speaking with Assemblyman Natisha Charles-Pantin. We're talking about the community care program. Yes. Remember, you can be a part of that, as well as the district Goodwill project. Yes. Yes, we have to be there for each other. We have to be a brother's keeper. Look out for each other, and let's be kind to one another and help as much as we can. We have to go for a short break before we continue conversations in studio this morning, and as we go, we invite you to help us. Share the live, share the live, share the live. We'll be right back.